The holiday season is all about joy, laughing and smiling, and if you're not confident about your smile, then you need to see my guest, and that is Dr. Regan Ackerman at Freedom Mini Dental Implants. Dr. Ackerman, I think what's nice, and I'm going to point this out right here, is that you're the person they see, so when they see you on television and they see all your passion and information and knowledge, it's you they're going to see in the office too. It's not a big operation.
100%. We are not a big corporate office. I'm the only dentist there. We're a small operation. We've got 2 other employees, so locally owned. It's just me. I'm the only dentist. So yes, I'm not just a face on TV and then you're going to go to the office and see 4 other dentists. You will see me and I will take care of you, start to finish. And I'm the only dentist there. We're a small family owned operation.
Okay, I'm really looking forward to this. This is the year in review. You could call it the Freedom Mini Dental Implant Yearbook. You could call it the best of the before and afters, but everyone gets good results. And I think that's what these pictures will show, that everyone who comes in, they look younger, they feel more confident. All of that's possible.
Yes, we change people's lives every day. People come in with, they've tried everything. There's Angela right there, and a lot of our patients become friends or love Miss Angela. She came with, like so many people, she had done everything possible to try to save her teeth. She had severe periodontal disease, bone loss, and she had tried to hold on to them as long as she could. So she knew when she came in she needed all her teeth extracted, and she wanted a better option than just regular dentures. So we were able to do snap-in dentures for her.
Look how much younger.
And yes, amazing results. She was so happy. She brought in pictures from when she was younger, and we tried, make the teeth look just like that. And I think we did a really good job, and she was extremely happy. So happy we're helping her husband out now. He just came in to start treatment.
Man, they're going to have some good-looking pictures, aren't they, for Christmas?
He was like, I want mine to look just like hers. So she has the snap-in dentures. So many people, struggling with dentures, loose dentures, don't want to have to use denture glue. We can do the snap-in dentures with mini implants. I know we'll go into more detail. It's just a less invasive, smaller implant, but changed her life, definitely, forever. Gave her that confidence. Her husband says she just takes pictures all the time. She loves taking pictures.
I don't blame her. And I bet that wasn't the case before because she didn't feel confident.
She was trying to hide her smile a lot.
Don't get me wrong, she's a beautiful lady regardless, but the fact that now she's confident, that makes a world of difference. Okay, up next is Rory. Okay, tell us about Rory's story.
Yeah, Rory is awesome. So he came in, same thing. He had tried, had some kind of what I call patchwork dentistry done on those front teeth, trying to save them. They had broken. He was missing a lot of teeth in the back. He knew that same kind of situation, needed to have his teeth removed, and he wanted his smile back. I love Rory. I actually just saw him today. He told me, he said, I want them to see my smile, 6 blocks down the street. So that's what we gave him. He actually came in today just for a checkup and just talking about how much it's changed his life, how much, people are constantly complimenting him on his smile, and he just got that bright, pretty smile. And he is, if you met Rory, he is just one of those contagious personalities, just such a positive spirit. He's a great singer, by the way. He comes up with little jingles for our office and stuff. So he's a wonderful person, and it was just so nice to be able to give him a smile back.
That's genuine joy there. Yeah, that's a handsome individual. All right, now up next, here's Phyllis. Tell us about Phyllis.
Yep, so Phyllis, similar, came in, failing dentition, missing teeth. They were breaking on her. She knew, her teeth weren't going to last her much longer. So for Phyllis, we were able to actually do the permanent teeth. So they're cemented in. It's a bridge, so not a denture for her. And I think we, did a really good job of maintaining her smile, not a drastic change, but still keeping it her and her personality, but just an updated, nicer, newer smile for Phyllis.
Her smile makes me smile.
Yes, and she doesn't have a denture, so she, nothing on the roof of her mouth. She can taste her food. That bridge is cemented in over the mini implants. So, she brushes them just like regular teeth, cleans them like regular teeth. So to her, it's just like having her teeth back.
Yeah, there's no plastic involved. We'll talk about both methods. All right, let's take a look at Chad and tell me about Chad's story.
Chad, another amazing story. I know I keep saying that, but I just love all these stories.
They're your friends.
So Chad came in. He had already had his teeth removed, and he couldn't tolerate a denture. I think a lot of the beard was he was hiding his smile because he didn't have teeth, and was self-conscious about it. So we were able to do snap-in dentures for him, be able to kind of trim that top denture back and make it tolerable for him, and gave him snap-in dentures, and just a world of difference. He came in, shaved his beard off, show off that pretty smile, and I mean, it's just amazing. So once again, just such a nice young man and deserves everything. And we were able to give him snap-in dentures, so no floppy dentures, doesn't gag them anymore. He doesn't have to use denture glue, because when he came in, he couldn't tolerate dentures. He couldn't even keep them in. He was, embarrassed because he didn't have teeth. So we were able to get him snap-in dentures.
Man, I love the confidence, but also, I mean, look at the age. I mean, the years just disappear. Fantastic. Congratulations to Chad. Okay, up next, Sean.
So Sean came in, missing some teeth. They were breaking on him. Same kind of situation. He knew he needed to have his teeth removed. Did not want a regular denture. So long term, we were able to do the cemented permanent bridge with him with the mini implants, and definitely gave him updated, fresh smile, but still not drastic. I think we do a really good job of, sticking with, their size, shape of their face and their smile, and he was very pleased. And he's got the cemented bridge where he's got nothing on the roof of his mouth. They're cemented in, they don't come in and out. He can taste all his food, chew what he wants to chew, just like his natural teeth.
Yeah, there's an artistic side of what you do. I mean, you're exactly right. It's got to fit their face. It's got to look natural, and it really does. In each case, it really does.
Right. We're just trying to give them the updated, newer version of their smile, but not change it drastically. I know so many people are, scared of dentures because they're afraid they're going to end up with, bucky beaver teeth or horse teeth, and we don't want that either. So we do everything. We take measurements and very impressions and records to make sure that we match, your existing smile, what you have.
Yeah, I was good. This is the wow book as we continue here. This is really the wow factor. Okay, and up next is Cheryl. So tell me Cheryl's story.
Yeah, so Cheryl had what we call tetracycline staining. A lot of people were born with it through their, medications their mother took when they were pregnant with them. So her teeth always kind of had this staining, and they were, breaking on her. They were just weak, so she knew she needed all her teeth taken out. And of course, for her, one of her biggest things was to get rid of that tetracycline staining, get that, big, bright white smile, and not be self-conscious about her smile anymore. So
pretty lady.
Yeah, so we were able to do the snap-in dentures for her.
All right, I am really amazed. This is even better than I thought. Okay, here's Corey. Welcome, Corey. Welcome to the show, Corey. Let's see what happened here.
So Corey came in, and he had already had all his teeth taken out and did not want regular dentures. He couldn't tolerate them. So we were able to give him snap-in dentures and give him his smile back as well. So, for him, huge confidence builder for him. He's a nice young man. I know he was very self-conscious that he didn't have teeth anymore, and once we were able to do the snap-in dentures for him, I mean, just boosted his confidence so much. And I think we showed him on a previous show, but he got a job promotion, and just everything, just started working in his favor. And he's just such a nice, young, hardworking man, and he deserves it.
He's going to be on The Bachelor next season. He looks great. Okay, now up next is Tanya. Let's take a look at her. Yes, hello, how are you?
Yes, so she had failing teeth, was missing some teeth. They were just kind of breaking, and she knew, came in and was like, I want them all taken out. I don't want a denture long term, not even a snap-in denture. So we did the permanent bridges on her, and same thing, updated smile.
Beautiful.
So, just a little bit lighter, natural smile, and she was very happy and can taste her food. Once again, those are the cemented bridges over the mini dental implants, just a less invasive way of doing implants. And she's got the cemented teeth she just brushes them every day, uses a water pick every day to keep them clean, and gets them cleaned every 6 months. Like
amazing results can be yours too. All right, as we continue, here comes Michael.
So Michael, you hear this so many times. People get their teeth extracted and they think, they're going to get dentures and it's going to solve all their problems. He couldn't tolerate dentures, didn't have dentures when he came, and knew that he wanted something better. So we did snap-in dentures for him, so he didn't have to use glue, no floppy denture, and now he can chew steaks and eat what he wants to eat. and has that smile back and that confidence back.
All right, we have one more here before we go to break. Ira joins us now. Ira, take a look, see.
Yes, so Ira came in with some dentures that didn't fit real well, and so we were able to make him some new dentures that definitely had better aesthetics and looks, and then we were able to do snap-in dentures for him.
No more glue.
No more glue, no more floppy denture, especially that lower denture. So many people complain about the lower denture because you don't get any suction from it. You're trying to use gobs of denture glue to keep it in. So a snap-in lower denture can be life-changing for people because they can eat again, eat that nutritious, healthy food, veggies and steak, and so it can definitely be life-changing.
And I like Ira because he's a Ravens fan. He loves Lamar Jackson, as do I, Ira. Thank you so much. Okay. Questions. If you have any questions, are you a good candidate for Freedom Mini and dental implants? You saw all the positive, amazing results. You can be on the wow factor too there. So all you have to do is give us a call if you have any questions. Dr. Ackerman will field those. 571-5263. We'll be right back. If you're as amazed as I was at that last segment, all those before and after pictures, it can happen for you. If you are not confident with your smile, now's the time to make that decision. Do something for yourself this holiday season. Give yourself a present, the present of a beautiful, confident smile. Okay, Dr. Ackerman. Those pictures were amazing. I was a bit wowed. So show people how it works, because a lot of folks are thinking, okay, do I throw away my denture? You're saying no glue.
Yes.
How does it all work? And why is your method less expensive, less invasive than the other?
Definitely. So I'll start with showing the snap-in denture option. So the implants I use, we call them mini implants just because they are a smaller diameter implant. So they're a lot less invasive than the bigger surgical implants. So when I place this implant, I will numb you up, just local anesthetic. I don't have to put you to sleep or sedation, and I'm not making any incisions or stitches. I essentially kind of, numb you up, make a little pilot hole, and then it's like a little one-piece titanium screw that will kind of screw and torque into the bone. And then the great thing about the mini implant, you don't have to wait for it to heal up another 3 to 6 months. The same day I put these implants in, I will put these attachments inside your denture, and you will leave the same day with the denture snapped on to those implants. So no more denture glue. Your denture is secure. It's not flopping around. You can eat better. And you'll wear this denture pretty much 24/7, but you'll be able to snap it out once a day, rinse and clean it, and then snap it right back in. And a lot of times too, the denture, like this is the model for the top, I can trim back the roof of the mouth some and help with that gaggy feel or help you taste your food again. So this is a great option, the snap-in denture. And a lot of times I have patients too that come in with a denture. They like the way it looks and fit, it just doesn't stay in. So a lot of times I can even use your same denture and save you money that way.
All right, so now here's the next method, which is amazing to me. Like you said, your third set of teeth. This is no plastic, no denture, and you had quite a few of the patients who decided on this method, right?
Yeah, when I was kind of talking about the cemented bridges, yes. So this option, so we're gonna use the same mini implants, so a lot less invasive, no incisions, no stitches. I'm just gonna place more implants for more stabilization, and then we have a bridge of teeth that's made out of a much stronger material than a denture is, and then this can get cemented permanently onto those implants, so it doesn't come in and out. And then you have nothing on the roof of your mouth. You get to taste all your food again. You'll brush these with toothbrush and toothpaste every day, just like regular teeth. And then we give you a water pick, or we call it a power washer for your mouth, just to kind of keep the edges clean. And you'll get it cleaned every 6 months, just like regular teeth. So this option is great. It gets cemented on. It's just like getting your natural teeth back.
No plastic whatsoever.
No plastic, no denture anymore.
And no more glue.
No more glue, no more denture. Taste your food, yes.
We talked about all the, the physical reasons as far as confident smile, and you saw how really it seemed like people had discovered the fountain of youth because they look so much younger. With that being said, there are more reasons to go to Freedom Mini Dental Implant, and you talked about folks who suffer from the fact that, okay, I've got glue, my dentures are ill-fitting. When you get them snapped in or you get the permanent teeth, you can eat what you want.
Yes.
Talk about that, because it's not only about the taste, but nutritional value of foods as well.
Function, 100%. Yes. I've had so many patients come, obviously we want the teeth they'll look good, 100%. But I've had a couple of say, I don't care what they look like. I just want to be able to eat with them. And I totally understand. So function is a huge aspect of it, because a regular denture, it's just sliding around and you can't eat with it. So snap-in dentures or the cemented bridge, you can eat steak again. You can chew those, veggies, celery, carrots, salads, all that good stuff. That, that is the purpose of getting implants, especially the mini implants, so that you can eat all that nutritious food again. And I should probably mention that, the consult, it's no charge. All you have to do is call the office and make an appointment. It's a free consultation. Like we mentioned before, I'm the only dentist there, so your consultation will be with me. We'll take a 3D x-ray. That's part of the consultation. It's no charge to make sure you're a candidate and have enough bone. And we're located on Dixie Hwy, right across from Valley High School. It's usually about a 30-minute consultation, and like I said, it's no charge. So if it's something you think that you would benefit from, it doesn't hurt to call, make an appointment, and do the consultation.
Well, let's talk about another advantage of Freedom Mini Dental Implants, and why you should call Dr. Ackerman, is the fact that when you said, find out if you have enough bone. In the former method, okay, in the surgical method, you had to have a lot of bone, and that's what's different. If you've been told no before, your answer is probably yes. How often do you have a no? 100%.
I'd say about 95% of the patients, I say yes, you're a candidate. There is a small percentage that doesn't have enough bone, and we'll certainly show the model showing how much bone I have to have.
There we go. So that's all coming up next. If you have a question, 571-5263. Dr. Ackerman will field those coming up next. Freedom Mini Dental Implants. Dr. Regan Ackerman is here. She's taking your calls at 571-5263. We talked about the difference between the surgical method. This is the evolvement, really, of implants. And it is less expensive, less invasive, and you're more likely to be, yes, given the green light to do this. So why is that? If you would, show them the model. That's a jawbone, right?
Certainly, yeah. So this is, imagine your mandible or your lower jaw. And this model shows that I don't have to have a lot of bone, just some bone. So it's hard to see the little hole in front of this big hole. The little hole is the hole that I make when I place an implant. The big hole is the surgical method. So they have to have a lot more bone. They usually make an incision and have to heal up. So this little pilot hole that you can kind of barely see, that is the hole that I need to make when I place a mini dental implant. So a lot of people that have been told they weren't candidates for surgical implants, either they didn't have enough bone, or maybe they need a bone grafting or a sinus lift, they could easily be a candidate for the mini dental implant, especially somebody that's been missing all their lower teeth for a long time. There's not much bone on that lower, but a lot of times I can place the mini implants and snap that denture, and it is life-changing for people. But yeah, I don't have to have as much bone to place a mini dental implant, because it's just a smaller diameter implant.
So for those who may have a bridge, or perhaps they have a birth defect or a tooth that they lost in whether it be a car accident or a sporting accident or whatever, you can help them too. There's good news, right?
Yes. I know we've talked a lot about dentures and missing all your teeth, but we do single teeth as well with the mini implants. Works, very similar. It's just kind of a smaller version. So if you're missing one tooth in the front, like you said, from a sporting accident or had to have a tooth removed, a lot of people are, trying to wear what they call a flipper or a partial, and it's miserable. If you have one, So we can certainly replace that tooth with a mini dental implant. Same thing, numb you up, just local anesthetic, and place the implant, and then we get the nice pretty crown, and it gets cemented on permanently onto that implant. So, get rid of that partial or flipper, and not just a single tooth. If you're missing 2 or 3 teeth, a lot of people had to have some molars extracted, your big chewers in the back, and they want something to chew with. So we can replace multiple teeth as well, place multiple implants, and then we make a bridge, and then that gets cemented on permanently onto those implants. So no more partial that comes in and out if you're trying to replace teeth with that, or if you're just missing teeth. Now you have something something to chew with, and aesthetically, you know, it fills out your smile and just a lot prettier.
Dr. Ackerman, we talked about the free consultation for those who want to visit you and find out, hey, am I a good candidate? Talk about payment plan options and all of that. What's involved in a consultation?
Yep. So when the patient arrives, the first thing we always do is we take that 3D x-ray, because that gives me, I want to have the information to know that you have enough bone and see everything before I see you. So we'll take the 3D x-ray, and that's all part of the free consultation. And then, you know, we'll discuss what your, you know, goals are, what you want and need, and I'll take a look and do an exam, and then we'll go over all your options. And just like I have, you know, we'll show you the models and go over cost and see if this is something that will work for you, you're a candidate for, something you're interested in. And we do have financing plans if you need to look at those, and you can apply while you're there. It doesn't bind you to anything, it just shows you what your options are. But like we mentioned, we're a small family-owned dental practice. I'm the only dentist there. We have 2 or 3 other employees, so we're very small. We're not a big corporation, and you won't be just a number at our office.
Yeah, everyone's situation is different. You're all individuals, but with that being said, you know, talk about cost, because I found this amazing in that, yes, it's better, it's less invasive, you know, you're going to get results very quickly, but also it's less costly. So although you can give us a general idea of how much less.
Right, yeah, so usually a third less, sometimes half, you know, less than the surgical implants, because we see a lot of people that come in with treatment plans for surgical implants, and it was just out of their budget and they couldn't afford it. And so we're able to give them a more affordable option. So, you know, especially for, you know, a single tooth, a lot of people come in, and usually our cost is about a third to half the cost of a surgical implant. Usually a lot less healing time as well, and like we mentioned, less recovery time and less, you know, healing as well.
So now, from this point forward, now when you send out that holiday Christmas card, you're going to be in it because you look great. You're right.
Yes.
It's like for those who have been struggling with their smile and said, you know, I'm embarrassed, I've been covering my smile, and when I talk, and maybe it's with a beard or mustache, the answer is Freedom Mini Dental Implants.
Yes, so we can change smiles for sure.
All right, so give them a call today. Now, location, we had a couple of calls about location, where you're located. You know Louisville well.
Yep.
You know all the landmarks.
Yep. So we're on Dixie Hwy, literally right across from Valley High School. So we are closer to the Gene Snyder off of Dixie Highway. You know, there's one little building in front of our office, so it is a little hard to find sometimes, but once you get to Valley High School, you should be able to find us. But we're on Dixie Highway, right across from Valley High School is the biggest landmark.
Yeah, you can throw away the dentures if you choose, or get rid of the denture glue, whatever the problem may be. They can help you. And you saw how natural, how beautiful her patients and now your friends look. And you can do the same at Freedom Mini Dental Implants. Okay, we're going to take a little break here, and then coming up, Don G will join us, and she'll talk about what's happening on Wave Country at 2 o'clock. That's next.